Assalamualaikum. My name is Shamsila binti Zulkarnain, and today I would like to present my case study regarding weight reduction. So, for the introduction, my patient name was Mr. I, male, 37 years old and married. He is currently work as a consultant at design and construction company, and he also has been diagnosed with obesity class 3. In Malaysia, about 50.1% of adults are being overweight and obese, according to WHO. Overweight and obese are defined as abnormal or excessive fat accumulation that present a risk to health. And BMI is a term that's commonly used to determine the weight status, and based on Mr. I's cases, his body weight was around 145 kg with a height of 168 cm, and after the calculation has been made, we found out that Mr. I BMI was categorized as obesity class 3 since his body weight BMI was around 51.4 kg per meter squared. The obesity is the result of genetic, behavioral, environmental, physiology, social, and cultural factors that result in energy imbalance and promote excessive fat depositions. And the risk factors of obesity can be divided into two, which is based on the individual factors and environmental factors. For the health complications that related to obesity is such as strokes, obstructive sleep apnea, lung disease, heart disease, liver disease, pancreatitis, gallstone, arthritis, and gout. So based on the diet diagnosis relations, according to the Mrs. I diet history, he liked to consume high fat foods as well as sugary foods. High intake of fat foods can increase the risk of severe health complications. The previous study has been reported that frequent consumption of fried foods was related to high risk of cardiovascular disease. And by increasing the intake of trans fatty acids, and saturated fats, processed foods, sugar, and refined carbohydrate, as well as the use of deep frying methods could increase the risk of abnormal obesity. Artificial sweeteners and sugar beverages also could increase the risk of obesity. For the medication, Mrs. I did not take any medication or drugs. Next, we move on to nutritionist assessment, which is starting from anthropometric assessment. As we can see, Mrs. I weight was around 145 kilograms with a height of 168 centimeter, and body fat was around 36%, in which beyond the normal range between 17 to 23%. Mrs. I BMI was around 51.4 kg per meter squared, in which has been diagnosed with obesity class 3. Adjusted body weight is around 96.1 kilograms. Ideal body weight is around 63.5 kilograms. And ideal weight range is around 52.2 until 70.3 kilograms. Next, we move on to biochemical assessment. What we can find out that patient total cholesterol, triglyceride, and LDL level was quite high, and patient HDL level was quite low. Next, for the clinical assessment, we found out that Mrs. I blood pressure was around 135/76 mmHg, in which has been found as at the stage of pre-hypertension. For the dietary assessment, overall caloric intake for Mrs. I was around 2,159, and what we can see that Mrs. I sugar intake was quite high, which is around 172.2 gram, and his fat intake was also quite high, which is around 75.5 gram per day. Next, this is the patient food checklist, and we can see that the patient like to consume fried foods, coconut meat-based foods, margarine, and sweets, condensed meats, and jam or kaya. For the finding or summary related to the nutrition history, Mrs. I having a irregular meal timing and he often skipped lunch, and patient only had the sugary drinks for lunch since past 1 year. Frequent consumption of sugary drinks about 3 times per day every day, and frequent intake of fried foods such as fried chicken, fried kangkong about 4 times per week. Less intake of fruits and vegetables due to less preference, and he liked to eating outside once a week, especially after playing a badminton, and he usually eat fried noodle or fried rice. The comment based on physical activity of Mrs. I is he will spend about 2 hours playing badminton once a week. For the nutrition diagnosis, firstly is obesity class 3 related with excessive energy intake, as evidenced by BMI is around 51.4 kg per meter squared. The second one is excessive fat intake related to food and nutrition knowledge deficit, as evidenced by excessive fat intakes by 177% from fat requirement. Next, we move on to nutritional intervention. Based on this table, show the patient energy requirement. For this one, I will choose adjusted body weight to calculate patient energy requirement, and we found out the patient energy range was around 1922 and 20,163 calories per day. Next, for the objective and principle, firstly is to attain and maintain a weight as close as normal BMI by educate patient on healthy eating methods, such as a small and frequent meal, teach a patient to follow healthy plates, which is suku-suku separuh, such as to have a healthy snacking before the meal time, such as a patient to eat and chew slowly, such as a patient to increase the intake of fruits and vegetables every day. Second, by encourage the patient to reduce intake of high sugar food by such as replacing a condensed milk with low fat milks, such as replacing jam or kaya with no sugar added peanut butter, such as to exchange the intake of sugar that being added in the coffee from 4 tablespoons sugar to 1 tablespoon of sugar. Third is encourage the patient to have adequate intake of plain water by at least 2.5 to 3 liters of plain water every day. And the fourth one is encourage the patient to be physically active, such as to have the exercise at least 240 minutes per week, such as walking, jogging, Zumba, and swimming. The second objective is to reduce the level of total cholesterol, triglyceride, and LDL within the normal range by educate the patient on knowledge of low-calorie and fat diet by such as the healthy food preparation techniques such as boiling, steaming, and grilling, such as the healthy food modification that are low in fat such as limit the use of cooking oil while menus, such as fiber-rich food to increase satiety and lower calories portion size, and suggest to have low-calorie kuih muih such as when roll, popia basah, kuih lapis, or kuih apam. For the macronutrient distributions, about 60% of carbohydrate, 20% of protein, and 20% of fat will be recommended for Mr. I. So this is the table show the food exchange and mealtime distribution for the patient. So for the menu planning for the weekdays, I suggest to give For the breakfast, I suggest to give a skim milk, sardine sandwich and apple. Morning tea, which is plain water and kuih lapis. Lunch, brown rice, tom yum campur and steamed vegetable, papaya and plain water. And for the afternoon tea is skim milk, chicken tortilla. Dinner, mee bandung, no sugar added orange juice and super skim milk, wholemeal bread and apple. For the another day, for the breakfast, I recommend to give a skim milk, tuna hash brown and banana. Second, for morning tea, I recommend to give plain water and cream cracker. And for lunch, brown rice, steamed fish, chicken grill and steamed kailan, and with a no sugar added watermelon juice. For afternoon tea, skim milk and pork ayam. And for dinner, brown rice, salmon, chicken grill and steamed broccoli, orange and plain water. And for supper is skim milk and wholemeal bread and also apple. For the third menu planning, I will recommend to give a skim milk, wholemeal bread with scrambled egg and banana, kopi O, kuih appam, brown rice, chicken grill, ikan tenggiri, steamed broccoli with also no added sugar or orange juice. For afternoon tea, banana milkshake and chicken pie. Dinner, egg aglio olio with a shredded chicken grill, orange and plain water. And for supper, I recommend to provide or suggest a patient to take overnight oat, which with a skim milk and oat and also some of mixed berries. For the nutrition monitoring and evaluations, set up with the appointment for the next 2 weeks, achieve weight reduction for at least 1 kilogram for 2 weeks, monitor and evaluate patient eating pattern, does 24-hour recall. Diet recall will be taken by nutritionists in order to make sure that Mr. I follow the diet prescription made by the nutritionist. And the last one, monitor and evaluate the patient lipid profile. For the discussion, according to the patient biochemical assessment, we found out that his lipid profile, which is total cholesterol, triglyceride, and LDL reading was high due to high consumption of energy-dense foods. Thus, study by Sun et al. Has been reported that frequent consumption of fried foods or energy-dense foods was related with high risk of cardiovascular disease. Second, the previous study also reported that consumption of high-fat, sugar, and coconut milk-based food was related with obesity and chronic diseases. The patient also liked to consume sugary foods and sugar-sweetened beverages. As a result of 4 tablespoons of sugar was added into the coffee. Study by Hoare et al. Has been reported that high consumption of sugar-sweetened beverages was associated with the weight gain. Next, the patient also claimed that he has irregular meal timing as a result of his food intake was high during dinner and supper. The previous study reported that meal skipping could give various effects on the body weight, lipid profile, and body pressure. And be physically active actually will help the patient in achieving healthy weight loss. The risk of hypertension, diabetes, and obesity can be reduced through physical activity and weight reduction. As a conclusion, the main goal of the dietary intervention for Mrs. I was to lose a weight for at least 0.5 kg by having moderate intake of carbohydrate, protein and fat, as well as to attain and maintain Mr. I lipid profile value such as total cholesterol, triglyceride, LDL, and HDL within the normal range. Since Mr. I was diagnosed with obesity class 3, so it is advised to educate Mr. I and his wife on having a low calories and fat diet by suggesting a few food modification methods such as replace the condensed milk with low fat milks because high calories or high fat diets will increase the risk of health complication later in life. So that's all for me. Thank you for watching.